Do I need to introduce myself first? I'm Mathew and I'm at third year at Russell's Hall. I think like in third year I'm expecting it to be a little bit different at first and second year, because like first and second year you're kind of more med school based and you're based in a GP trust like once a fortnight. So because we're in hospital say 4 days a week, I think it's going to be, you have to be a bit more disciplined. I mean, you're not going to be able to go out on say like a weeknight as much. I don't think it's going to be too difficult to get a good work-life balance and hopefully be able to adapt to that. I think every medic would say they're probably a little bit scared because like patients, you have to kind of be careful what you say and you have to kind of reassure that you're not a doctor and that you're a patient. So I think that side of it is a little bit, maybe a little bit apprehensive, but I was also quite looking forward to like getting out of med school, getting out to being stuck in lectures and being taught that 9 till 5 every day. I think it's nice to kind of get a feel for the hospital yourself, get a feel for how everything works, and like hopefully that'll be quite beneficial. So I know that we have to have quite a lot of introductory lectures and things, and like I know that at Russell's Hall here you do quite a lot with the clinical educators for all the clinical skills, which would be really useful. I was quite lucky that I know somebody in an older year who had been on placement here, and they told me quite a lot of good things. I heard that like there's quite a lot of good teaching, it's like really organised, and we were lucky enough to get an email through quite early as to what our placement was, and so it was quite good for us to like arrange transport and things, and like the online website for the Ron Grimley Undergraduate Centre is really useful. Like you can see your timetables there, the consultants you're attached to, so it makes everything a bit easier to organise before you come here. With regards to like being at Russell's Hall, I probably would have liked to know how like keen and the F1s and F2s are to teach. I think sometimes it's better to get teaching from them because they can kind of remember how they felt more as a third year than say a 60-year-old consultant who's quite old school, and it's a bit harder to kind of relate with them, I think. To try and like put yourself out there as much as you can on the wards, try and get involved with ward rounds, try and get involved with like the nurses, the physios and things, because if you don't put yourself out there then you're just going to kind of get left behind. I think if you try and put yourself forward a bit, it's better. At Russell's Hall they're really good because you get a good balance between teaching that's organised for you and then teaching that you organise yourself as well, extra teaching to do with like OSCE practice and things. So I think it's so far the best attachment I've had. The ed fellows are quite good in the fact that they're really proactive and really easy to approach, really approachable, so that's good. Office staff and Mr. Raymond really approachable, and you also get your firm leads. You get attached to like one main firm lead and 3 other consultants, all of who kind of know you by name, and always make sure you're getting your teaching and make sure everything's going right, so it's quite a lot of support, yeah. We're timetabled in, so we're here from 9 till about 4, so that's Monday to Thursday, and then on a Friday you either got GP or a day of pretty much catching up on everything you've missed out and trying to catch up on lectures and things. So you do put quite a lot of hours in, but it would be worth it one day, I suppose.